Okay, so we're away again now in the second part of today's question and answer section with our pharmacist James Geraghty. We've now moved to Facebook, so if you're joining us on Facebook, you are very welcome to what we're doing. James, will we crack on this side of the house?
Yes. Very
Okay.
well,
Lady has athlete's foot for a few months. Over the last few days, it has gotten worse, almost septic. She went to the doctor and got antibiotics, and they've helped a little. It's very itchy and red again today.
Okay.
Any advice?
Well, usually athlete's foot jar is more to do with a fungal infection, and usually what I'd recommend there is Dactarin oral cream. You can get it in the pharmacy. So, but the key here, Jerry, is if she could get Dactarin powder as well, or Canesten powder. The powder is key, and you put that in your sock and sprinkle a little bit over the feet, and it makes a huge job, and it keeps the foot dry, because the tinea pedis, the actual fungus infection itself, it loves a little bit of moistness and damp. So if the lady uses a little bit of powder, it makes a huge difference. But to use it 2 weeks after it's gone, that's the key. And to continue to use the powder, especially for about 2 weeks after she sees no more infection. Now, just obviously the doctor has seen there that sometimes it can split the skin and you may get infection in. So continue to use the antibiotics as well.
Okay. Perfect. Any cure for vertigo?
Usually, Ger, the cure for vertigo, you can pop into your doctor and he'll give you some tablets for it. Usually the recommendation would be Stemetil, or there's another one, what is it, Circ. And either one of those, I have seen a very good results with those.
Perfect. Paul or James and Jerry, my calcium levels were slightly up and my cholesterol 6.7. Is this dangerous, and what should I do next?
Well, obviously, if the doctor hasn't given anything there, Ger, they're not 6.7 is not bad, but it needs to be watched.
Okay.
You want to be coming in around the 5, so the doctor will be keeping an eye on that. So the doctor may be suggesting, obviously, watching the diet, exercise, and maybe a couple of supplements. The calcium, again, the doctor will be watching that just in case. You start too much calcium in the blood can have an impact on the kidneys, so they'll be watching that as well. So it's not that it's dangerous, but it needs to be watched. So be cognizant. Was it a lady or a gentleman?
Don't know. We don't know.
So make sure that they're talking to their GP over that.
All right. James, can you help me with insulin resistance and hormone imbalance? What can I do? Is it PCOS, James? PCOS.
Polycystic ovaries.
Okay.
Syndrome,
And perimenopause, and I'm on a lot of pain medication. I'm on blood pressure tablets, and I'm also on 2 cholesterol tablets.
Now that's a big question there,
yes.
Ger. And if we just break it down,
please.
The best I can do for this lady with insulin resistance, I would say to be very cognizant of your diet and the amount of carbohydrates you're taking and simple sugars into your diet. Because if you have insulin resistance, it means that the cells have become resistant to insulin.
Okay.
So you need to make them more sensitive. So the way that you do that is increase your protein, increase your fiber intake, and what that does is it decreases the capability of your sugars to get into your blood too quickly. Okay? So that allows the pancreas, when it releases the insulin, the cells become more sensitive to it. So even having a conversation there with a nutritionist or a dietitian would be very, very important. Obviously, because she's with that polycystic ovaries, and that could have an impact with the hormonal imbalance and the perimenopausal, and on a lot of pain medication and 2 cholesterol tablets, we need to be looking there and making sure that any supplements that she's taken, that the lady is taking, that they actually benefit the actual outcome, rather than sometimes you can be taking a supplement there that mightn't actually have a positive improvement at all. So in that case, Ger, I would love to talk to that lady. If they could just even email me on james@malloyspharmacy.com, or give us a call on 096 60072. But the first thing I'll be doing there, Ger, is increasing protein and increasing fiber in my diet, and be careful of the amount of sugars that you're taking in, because that insulin resistance, it has a massive impact on the body.
Okay, all right. There's a lot going on there,
Yes.
isn't there, James? Okay, I'm on cholesterol tablets, which are working well, but I have aches in my legs ever since I started them.
Quite common, Ger, with cholesterol tablets, but what I would suggest there is a course of coenzyme Q10, 30 micrograms, and you can get that in your pharmacy. You take them about 4 times a year. You don't have to take them all the time. Sometimes cholesterol tablets, to reduce down, the statins reduce down CoQ10 in the body.
Right.
And you can end up with this aches and pains, and you're thinking, I'm getting older. It's not that. It's the level of CoQ10 has been decreased. But you can top that up and use them about 4 times a year. So I would say during the spring, summer, autumn, winter, just use a course of, for 1 month, of CoQ10, 30 micrograms, one a day.
So maybe January, April,
January, absolutely, Ger.
July,
Absolutely.
October.
And you'll find that that starts to ease down that aches that you're getting in the body. In extreme cases, you can get something called rhabdomyosis, Ger, by the use of statins over a long period of time. But again, this is really important. Just mention that to the doctor and the pharmacist next time you're in.
What drops would you recommend for glaucoma?
Usually I recommend anything to do with glaucoma, Ger, we need to be talking to your optometrist or your ophthalmologist
To be
there.
safe.
Because there's a number of different ones, a number of them have different side effects, Ger. So it's very important from that perspective that they actually talk to their optometrist or to their ophthalmologist.
Caller suffering from mucus, it's at the back of their throat. Would you have any herbal remedy?
I find, Ger, and we were just talking about this earlier on, but I've had a little bit of a mucousy throat recently, and I find that the propolis cough bottle is wonderful. It soothes the throat, but it also makes it a lot easier to bring up that flimmy feeling that you're getting at the back of the throat.
Perfect. An over 50s woman, what can she do to increase protein intake? A very active person.
Well, if you go in, Ger, into your health food store or into even into our own stores, Ger, we have a Nutriside protein, vanilla, strawberry or chocolate, a couple of scoops of that every day. You mix it in a little drop of milk or water, whisk it round. You can put a little bit of fibre into it. You can put a little bit of chia seeds and drink that down, and that'll give you about 50 grams of protein extra every day.
Once a day?
Once a day. Just take it once a day, and it's very easy to take, Ger, and it's calorifically very, very low.
Okay.
But what it does do, Ger, it feels, your satiety, you feel a lot fuller with it.
I get you.
So the idea, of you're going, you might have a couple of scoops of protein in the morning. You find that around 11 that you're not that hungry. You won't go out and eat a big bun or big sugary breakfast or something like that, So that's the reason why this whole idea of managing your sugar levels is so important. And that's even referring back to that lovely lady, Ger, with insulin resistance. Increase your protein intake. And if you feel that you don't like the powders, like say for example sardines, salmon, like all your vegetables, all of that have a fantastic way of increasing protein levels. Fruit, absolutely, Ger. And the reason why fruit is good is, and we're just going back to the insulin resistance there, Ger, is that there's lots of fibre in fruit. And by taking your fruit, say for example your apple, the skin actually acts as a fibre, so it slows down the release of the sugar into the bloodstream.
Okay, now, what would you say to James, please, about this? If you take resveratrol, cholesterol-reducing capsules, if you're getting a Prolia injection for osteoporosis?
100%, Ger. Absolutely, no problem at all.
Nothing contradictory there?
Nothing at all now. The Prolia usually get every 6 months, I think it is, Ger. And the resveratrol, you take one of those every day. It's very, very safe, but over a period of time. But again, Ger, if we're talking, I see some people come into me, James, and they'll say, I'm taking resveratrol. And have you done anything about your diet? No. You got to do something about the diet. And what we're talking about here, Ger, is like over the Christmas, was I naughty? Yes. I had the purple chocolate.
Weren't we all?
I dipped into the caramel cream in the Cadbury's box, But tomorrow morning, Ger, 6:30, I'm in with the great Stephen Donnelly into the pool tomorrow morning.
Okay.
So we're back at it.
Yeah.
And that's the important thing, Ger. Okay, don't be beating yourself up, but you have to put in a little bit of effort as well.
You have, absolutely. Yeah. It's a quid pro quo.
Absolutely.
Good afternoon, gentlemen. What would James recommend for IBS? That's irritable bowel syndrome, isn't it, James?
Absolutely.
Asks Michael in Claremorris.
Well, I would love Michael to go into our wonderful store there in Claremorris, Honeybee, and ask them for the bowel support, 1 sachet a day. Take it in the morning. And that's very, very good at calming and helping support people with IBS, Ger. So with IBS, you have always this ongoing fear or worry about, am I going to get the runs? Am I going to get constipated? How am I feeling? But we have found even people that take maybe a week of the bowel support sachet, it just gives the bowel, it just gives that whole system a better feeling.
It allows the bowel to breathe.
The bowel to breathe. That's a very good way of putting it, Ger. And once you can help that bowel, it actually starts to help itself, and therefore you get that easing of those symptoms that you're actually afraid of getting.
Perfect. All right. Now, what's the cause of losing your hair? Lady in her 70s says her hair is coming out in fistfuls. She's on medication for blood pressure, but her doctor says that is not the cause. She's trying the hair and nail supplement from the health store, but no improvement. What does James think?
I would love to know, Ger, how long she's on the hair and nail
This is the key.
So that's the key. But if she is on that, please give it some time. And what I'm going to say to her, would she add in some silica into that?
How would you?
Hubner silica capsules. And if you go in there and do that, and so if she uses the skin, hair, and nail supplement and the silica for about 6 months, I can guarantee her an improvement. Guarantee her an improvement. And I'm going to be a bit brave here, Ger. If she pop into a pharmacy or health store and get a little bit of rosemary oil, yeah, and just massage it into the scalp, it's very good at just stimulating the blood vessels.
How often?
Once a day.
Once a day.
Yeah, but don't overdo it now with the oil. Some people go berserk.
Here's another thing as well with that lady. Should she mind how often she washes her hair? Because you know how they can make
absolutely, Ger. Twice a week, I would say, just to ease everything down. Because especially it's a lady, and that's a very sensitive point for ladies. So we need to be careful on that, Ger. So wash twice a week. Put in a little bit of rosemary oil. Massage into the scalp and use your skin, hair, and nail supplements for that period.
Now, I am 30 and I have a bad knee. What do I do? Simple as that.
Well, that's a very straight question. Well, the first thing we need to find out is, why is it a bad knee?
Yeah, 30. Yeah?
First thing, is there inflammation? Is there an ACL issue? Is there anything?
What's an ACL issue, James?
It's a little tendon that goes at the back of the knee, and it can be really anterior cruciate ligament. And it can be very, very sore. So there could be issues with that. Is that the back of the knee, the front of the knee, left or right? So the first thing we have to look at here is, number one, GP. Go in, get some anti-inflammatories. Number two, physiotherapist. Get a review done. As a 30-year-old, you need to be getting this sorted, that you don't want to become a chronic issue. So by doing that, you're setting yourself up. And I have found, Jerry, when you get an injury, if you approach it right and it comes at you again, you know how to deal with it.
Yes. And
that's really, really important. So rather than letting it go and it becoming a real problem, you understand how to deal with it.
That is true. Hi, men. My cholesterol is 6.5, no blood pressure. I walk a lot, not on meds, thankfully. So,
well, I'm going to say to that person, man, he's a man, isn't he?
Yeah. See, I think he is a gentleman.
It sounds like a gentleman. Well, if that was the case, I'd ask him to come on my journey, Ger, where I'm 5.7. And I'm on the Multifiber Plus, the resveratrol, and the Regis Rice for the next 6 months. And I'll be going into the wonderful doctor in the Loftus in 6 months' time to see what he thinks.
What the next move is. Okay.
Yeah.
James and Jerry, just wondering if there's here was polymyalgia now again. If there's any relief for polymyalgia, awful stiff fingers and sore. I'm on painkillers and a steroid, but not much relief. Thank you, says Seamus.
I would definitely add turmeric and Osteoflex to that, Ger.
Over the counter again.
Over the counter. Pop in. Osteoflex, wonderful product. We're getting great results with it, Ger. And the turmeric as a natural anti-inflammatory. And add that in for Seamus. And again, for about 8 weeks. So you don't have to go long term there, Ger.
Okay.
He should be knowing whether he's getting relief after about 8 weeks.
Perfect. All right. Now, this one. Can you ask the pharmacist? I suffer from plantar fasciitis. I've had some rounds, I don't know how many, of cortisone injections and plasma treatment, along with vigorous physio, orthotic insoles, and still have heel pain in both feet. I've given up walking and doing aqua in the pool because the impact is less. I use compression socks and still suffer. This is now going for 4 years. Can you please recommend something?
That is tough, Ger.
That's a puzzler.
That's a puzzler.
Yeah.
Plantar fasciitis, cortisone injections, plasma treatment.
Yeah.
I'm going to be brave here and say, Jerry, would they consider going to a podiatrist that, I went to last year. Extreme Orthotics in Sligo. I don't know if I can recommend them, Ger, but I went to them and they've transformed me. And I had that fasciitis issue, and it did a wonderful job. And I know that they're talking about orthotic soles, but it's just having a look at that, Ger, because it's like cortisone injections in plantar fasciitis. That's an extreme step.
It's very rare.
It's very rare. Like, usually, anti-inflammatories, orthotic insoles, physio, that should see. So maybe there's something else going on there that we're not aware of. And the fact that it's gone on for 4 years, I would definitely recommend seeing those people, because the guy that looks after that is a highly qualified orthotist, as well as a podiatrist, and he may be able to come up with something else.
Perfect.
If they give me a ring, 096600072, that's 096600072, and we'll find that number for that person if they can.
Thank you.
Fair enough.
Now, another caller, James, has had nail fungus for the last year. They've tried lots of remedies and it's still there. What would you say?
What I'd be saying there, Ger, is number one, They need to tried lots of remedies. They need to be talking to their GP there, Ger. Sometimes they get these lacquers that they put on the nail, but you need to be so consistent with that, Ger. You know, if it's on the feet, usually there's a product called Lamisil or Nail Derm, and they're very, very good, but that needs doctor referral, because they have to keep an eye on liver function for that.
Okay.
That's not it. Don't panic about that. It's just part of the treatment. But it's very, very good at getting rid of that. And the term is about, I think it's about 6 to 12 weeks, and it's quite effective. But ultimately, if this person has tried lots of remedies over the last year, it's time to talk to the GP about getting the oral therapy for it.
Repeat, please, the names of the products you mentioned about cholesterol earlier on.
So the ones that I'm taking are Multifiber Plus, resveratrol, and Red Yeast Rice, and I'm using it for the next 6 months until my doctor's conversation. But on top of that, Ger, I'm watching the amount of sugar I'm taking into my diet, and I'm also actively training about 5 times a week, and I'm doing about an hour every day. So I have to be honest with people, that's what I'm doing.
That's what you're doing.
Yeah.
James, please. A young man has an overgrown bone in the thigh for years, now very painful, and movement is bothersome. Any suggestions? What would that be, James? I never heard of that before.
I have never heard of that before,
No,
Ger.
overgrown
I
bone.
think that it's outside my,
Yeah.
I suppose, my sphere of expertise, Ger. But I would be suggesting a conversation with the GP or an orthopedic surgeon.
Now, this one, I'm not quite sure about this, but I'll read it anyway. Ask him if he's ever heard of Paddy Powerful Bottle, and is it okay to take if you're on blood thinners? I'm taking it with 4 days, and I'm on blood thinners.
I would say stop taking that bottle.
Are you familiar?
I've seen what's in it, Ger.
Okay.
And it's not that I'm against what's in it. It's just that there may be interactions there with the blood thinners.
With the blood thinners.
That's what you got to be careful there. So if
the
that person is taking that bottle, I would avoid for the sake of the blood thinners, because that could have a big impact on it.
Looking for advice regarding Wills-Ekbom disease. I'm currently on gabapentin. My blood circulation, which was very bad, has improved substantially also. Any advice or recommendation? Well, now, James, the first thing I have to ask you is, what's Wills-Ekbom disease?
I have to be honest with you, Ger, I don't know.
Okay.
But you know what we're going to do? We're going to find out.
We're going to go
and we're going to look into it, and next month we're going to come back to that person. Will you remember that, Ger?
I will.
And I'll remember it as well.
And gabapentin, James, what's that used for?
Gabapentin is usually Neurontin, Ger. It's for nerve pain usually.
Okay.
You know, it'd be something like Lyrica. You'd often see Neurontin and Lyrica issued together. Usually would have, say, people with lower back pain or in very bad pain, Ger, to be on Neurontin and to be on Lyrica.
Now, refer, James, to the picture that's been given to you, because it goes with this question.
Yeah, let's have a look, Ger.
James, I developed a rash on my hands, face and other places in my body just after Christmas. Have had steroids and antihistamines. Still they are red and itchy and sore. My face and hands seem slightly swollen, and they've sent us a picture of their hand.
Yeah, it looks swollen there,
It does,
Ger.
yeah, and angry, doesn't it?
Yeah, it does. And let's see what they've been on, Ger.
So they've been on steroids and antihistamines.
Okay. So what I'd be suggesting there, Ger, if we can go in into a pharmacy and we can get some La Roche-Posay Lipicar M. So La Roche-Posay Lipicar M AP. And the AP is very important because it's antipyretic, which is anti-itch. Yeah,
I get you.
And that's very, very effective to massage into that area. Now, what I'd love them to do is to be able to pop into the pharmacy as well. And they go in and they get a product called Hydromol, Hydromol, and it's in a liquid version, and they use that as a shower emollient, so they can wash themselves down and just clear off whatever is on the skin if there is a reaction here, Ger, because they've been on steroids and antihistamines.
Yes.
So sometimes whatever may be on the skin mightn't have left, so it's continuing to cause this. I'll give you a good example. Remember years ago the wool they used to use in insulation, Ger?
Yes.
And people would go
the
and they'd
fiberglass
wash
types.
the fiberglass, and then they'd get up the next day, they'd have a shower, everything would be fine, put their old clothes back on again.
Back to square one.
Back to square one. Terrible, terrible. And again, if we can look at this here, Ger, if we get some Hydromol liquid, go in, have a shower with the Hydromol, and then come out of the bath, and the La Roche-Posay Lipicar MAP, very important, antipyretic, and use that, massage that around the affected areas. I feel that this gentleman or lady, along with the steroids and antihistamines that have been prescribed, that should see a big, big improvement.
Very good. Well, James, here ended the lesson, because that's it for today. Thank you as always.
Great.
Remember again, friends, if you're watching this and looking at this and listening to this on our Midwest Radio or the Malloy Pharmacy Facebook page,
Yes.
you can find more information, of course, by calling the team on 096 60072. You can log on to the website, which is malloyspharmacy.com, and you're back next month with God's
Next
help.
month,
James Geraghty, thank you for being with us.
Have a good day.